Gus Alva. I'm currently the medical director of ATP Clinical Research, a private neuropsychiatric clinical research group that houses a center of excellence in the city of Orange in California. Super happy to be here. It's a brave new world, right? I think that there's a lot of stigma associated with different types of substances, including psychedelics. But, a lack of rigor is what probably stirred the pot initially. And I love the fact that we are being responsible about doing investigational trials. And we're trying to figure out whether psychedelic agents may actually help us with hitting a reset button and then getting somebody out of that default mode network where they've just been constantly ruminating, and then really getting that salience, or again, getting a better network connectivity so that people can actually, snap into their better selves, right? And that's what psychedelics pretty much offer at the present time. It's exciting seeing information like what COMP360 just shared, specifically taking a look at the results from the 006 open label psilocybin trial that basically showed that there's an enduring benefit 6 months out that replicates what was noted in the double-blind trial with the 005 study. Obviously, I'm one of the investigators that's helped out with those particular projects. So I've actually seen patients come in and receive the treatment and then subsequently have sort of a transformational change. Needing to be anchored with psychotherapy and a trained therapist, but also the duration of time required to actually supervise the individual. So it's an interesting setting in that we're going to be seeing changes with maybe a risk evaluation mitigation strategy that's built in to the use of these agents. But as things look, COMP360 may actually be the first company that actually has a green light to actually commercialize something that could be transformational for patients. And it's interesting seeing the inroads because, beyond psilocybin, there's the active form of psilocybin. Certainly there's synthetic MDMA, LSD, 5-MeO-DMT. There's a lot of different psychedelics that are being tested out right now. So I'm excited because I think that, there are certain characteristics in patients that are required for a psychedelic to work well, because people can go through a good trip or a bad trip, right? And I think that part of what dictates maybe a positive experience is the openness or curiosity that somebody might have. And so it's going to be really interesting taking a look at how we select patients and how we prime them into the potential benefit associated with, agents like psychedelics.